Hi, good evening. My name is Pramod Kumar Kurwa, and I'm here today for my project proposal on health information. Uh, Let me share my screen. So, today my topic is about health information technology, and okay, when coming to the introduction, health information technology is more important for providing uh, patients' data and for the coordination with the doctor and to encrypt all the data provided from uh, the clinical department, like ECG, for example, like ECG, blood pressures, and the sugar levels, and the blood percentage, and the volume of blood, how much the volume the patient have in his body. This has to be electronic. So because of these, the data will be accurate, and that will be in a uh, developed way. So when coming to the introduction, health information technology needs to be electronic methods to manage patients information, and supports health information management across computerized systems, design development and maintenance health information system, ensure quality care, and provides patient care, and include clinical decision support, electronic health records, and also remote patient monitoring and electronic prescribing. This has to be done because to collect and agree to collect the data from various internal sources for analysis and reporting. And I can say like this can be done for integrated system for all priorities, and caller navigation, and field documentation for transport to alternative destinations. And the purpose will be like electronic medical record for community health paramedics. And this has to be done by a clinical decision support tool, and the data has to be encrypted in a database, and the tool has been developed and uh, get divided for the patient data, and the doctor has to analyze through it. And when coming to the point, like why we increase in the use of health information technology, because of the outcome has to be improved regarding the healthcare, and enable the patient data tracking for decision support, and facilitating care and coordination in healthcare delivery, and improve healthcare practical efficiencies to optimize patient treatment histories and other key data. So for all these factors, the health information technology has to be developed, and it has to be electronic and computerized. The main reason for the electronic system and computerized system to reduce the medical records, not to interfere, not to mislead to the raw data, or mislead to the existing data, not to replace the others data instead of the patient's data. This is the main reason to track for decision support, to enable the patient and has the coordination with the doctor. And remote patient monitoring, how this remote patient monitoring works. Nowadays we get to know that we can even record our daily activity on our mobile smartwatches, or and also on the smart earpods as well. So growing popularity for need for clinical evidence and care modality surprised by the constraints of COVID-19. Corresponding need for expand access to healthcare involves connected electronic tools, integrating patient medical data to healthcare facilities, care patients with myriad conditions like hypertension. So these are all the factors where these are done in a electronic way. For example, go with the COVID-19 report, that has to be RT-PCR, that has to be computerized, and that has to be electronic. That's the major part that we are facing from the last 3 years. And when coming to the hypertension and myriad conditions, these are all has to be electronic generated reports due to the system has to be the facility healthcare facilities has to be integrated and migrated the data from the database, and has to calculate by the tool, and expand by uh, uh, corresponding the data by the healthcare department people, like the doctors, physicians, technicians, etc., etc. And when coming to the basics of a remote patient monitoring program, and the RPM system is the main system that affects on, in healthcare department. And when coming to the basics, are used to treat both chronic and acute conditions. Sorry, acute conditions. Clinical clinicians observe patients in real time, improve outcomes. Continuous patient tracking for ongoing care needs. Uses devices as weight scales, blood oximeters. Also use wearable like smart watches. Track patient recovery after discharge. Patients provides array of biometric data. So these are all the basics of a remote patient monitoring system, like activity level, blood sugar, heart rhythm, heart rate. These are all to be monitored by, I can say, like smartwatch. Like go for an Apple Watch. We have an option for healthcare where we can observe our heartbeat per minute, and we also get to know the blood pressure. We also get to know the heart rhythm. We also know the activity, and we also know the blood sugar levels by just a smartwatch. Think about it, if it's a continuous part of tracking for ongoing care needs, the department will always have an electronic device that has to be monitored. The clinicians observe patients in real time, improve outcomes. So these are all has to be done in a RPM system where the first they're gonna collect and then they're gonna transmit and then they're gonna store the data. So this is how it works. And when setting up an RPM system, identification of specific needs for a program, establishment of a team with specific goals, sourcing for an RPM program coordination, develop and implement a platform patient connection, sourcing for a long-term vendor, connect with home health care providers, issue guarantees to support program extension. How a RPM system can be built is explained in this slide. So when for a best identification, we need to have a team for specific goals, and the team will lead to the destiny. That's how I believe. So sourcing for an RPM program coordinator. The coordinator has to coordinate with the team members and has to develop and implement the platform, and with a with a source with a long time sourcing vendor, and connect with the home healthcare providers, connect with the patients, connect with the doctors, and issue a guarantee for the expansion. And how this RPM program works. This is actually a wireless enabled sensor for data collection and storage, and connected to an additional sensors from healthcare facilities. And this has to be connected for Express provided databases to have the relational applications, have the raw data, the medical data. And data collected storage in relational databases has to provide users with the connection interface, and sends alert to the patients and healthcare providers. That's how the RPM program works. So this is a regular process, and this is how the monitoring has to be done by a user. And this is how the healthcare physician or a healthcare person will take care of a patient by monitoring the RPM system. So what are the benefits that we have by RPM? So I can say like strengthening relationship between the patients and the doctors, and cost reduction when compared to the what we say physical in-person appointments or physical appointments, and improves data-driven clinical decision making, and builds a patient engagement, and also supports patient experience, and improves patient experience and satisfaction, and also prevents spread of infectious diseases like dust allergy, smoke allergy, pollution, etc., etc. And it also helps in increasing in the work productivity, boost net patient value, and boost care given give a connectivity and involvement in care, enhances patient engagements in healthcare delivery, improves patient self-care management, care plan adherence, and improves patient experience and satisfaction. And there are also some disadvantages for remote patient monitoring. Not accessible to all. It's technology reliance, and that network has to be 24/7 in a good condition. The poor network connections will limit in functionality, and lack of potential provider buy-in. So potential errors rate in existing RPM programs, and patient and doctor skepticism, need for additional customer healthcare software. The software has to be in separate, and that may also charge you. Like, that may also cause some bugs. So these are all the disadvantages for the RPM monitoring system. And how we can improve this, and need to make patient engagement a priority, need patient and care providers commitments, need for patient to generate accurate information, awareness to patients on important healthcare information widen the internet connectivity. These are the ways that we can improve to develop an RPM system, like to have the accurate information of the patient for the healthcare provider, healthcare user, or by widening the internet connections and improving patient awareness regarding the health information. These are all the ways that we can improve RPM system. And these are some of the references which I had to provide, which I used to create a research and proposal of my project. Thank you.